Hi, I'm Rocco, and I'm doing Chapter 13 and Chapter 14. So, Chapter 13 talks about avoiding substance abuse, and addiction. Addiction is persistent, compulsive dependence on a behavior or substance, including mood-altering behaviors or activities. Alcohol is the most widely used and abused recreational drug in our society. About 56.4% of Americans consumed alcoholic beverages in the past month, with 24.6% of people over 18 binging on 4 drinks at one sitting, if female, or 5 drinks. There are short-term effects and long-term effects of substance abuse and use. Some short-term symptoms are decreased breathing rate, muscle aches, etc. Some long-term effects are high blood pressure, increased risks of cancers, nervous system and cardiovascular system effects, and damage to the liver. So say if someone is addicted to alcohol and they can't go without an hour without having a drink, they would have something called alcoholism. Alcoholism is a condition in which personal and health problems related to alcohol use are severe, and stopping alcohol use results in withdrawal symptoms. Another one is smoking. Smoking's health impact is huge. It cuts 10 years off the typical smoker's life expectancy, and it claims more lives each year than illegal drugs, alcohol, HIV, motor vehicle accidents, murders, and suicides combined. Nicotine is the primary stimulant chemical in tobacco products, which can be very addictive. Along with that, the tobacco itself is covered in brown tar that has at least 70 cancer-causing chemicals. Some of the main types of tobacco use are in cigarettes, cigars, smokeless tobacco, hookahs, vapes, and more. Some of the short-term effects can be nicotine poisoning. Nicotine poisoning is experienced by beginning smokers, including dizziness, diarrhea, lightheadedness, rapid and erratic pulse, clammy skin, nausea, and vomiting. Some of the long-term effects can cause cancers, lung problems, bone loss, and more. Drug misuse involves using a drug for a purpose which it was not intended, while drug use is defined as an excessive use of any drug. Some of the most commonly used drugs in today's society are marijuana, cocaine, ecstasy, ketamine, caffeine, and more. To help overcome drug use and abuse, there are programs to help. Drug treatment usually includes medications and behavioral therapy involving individuals, groups, families, and led by drug counselors, psychologists, and/or psychiatrists. For Chapter 14, it talks a little bit about STIs and how to reduce your risk of acquiring them. STIs are an infection spread through intimate contact with another person's skin or bodily fluids. Each year, nearly 20 million Americans contract a sexually transmitted infection. About 10 million of these new STIs occur in young people between ages 15 and 24. Some STIs, such as chlamydia, are relatively mild and treatable, and some, such as genital herpes, are relatively mild but incurable. Others, including HIV and AIDS, are incurable and often fatal. Early symptoms of an STI are often mild and unrecognizable. For men, you might experience a drip or drainage from the penis. For women, you might experience vaginal discharge, burning or itching, pain, and more. Some of the major types of bacterial STIs are chlamydia, syphilis, and gonorrhea. The most common one is chlamydia, and most people who get it display no symptoms. To treat it, it is treated with antibiotics. Gonorrhea is the second most common one. In men, you usually notice white milky discharge with pain while peeing. For women, symptoms are sometimes absent, but if they are there, it'll be a yellow discharge. To treat this, you must also take antibiotics. And for syphilis, there might be a sore located at the site of where the bacteria appeared or was made contact with. To treat this, you must be injected with penicillin. Some of the major types of viral STIs are herpes, HPV, genital warts, hepatitis B, HIV, and AIDS. Herpes is a condition characterized by sores or eruptions on the skin. HPV is a group of viruses, some of which are linked to cervical cancer, and some of which cause genital warts. Genital warts are small, fleshy growths on the cervix, vagina, vulva, penis, scrotum, or anus. These can lead to cancer, but there are some vaccines for them. Hepatitis B is one of the 7 forms of the hepatitis virus, which infects the liver. Hepatitis B is the most common sexually transmitted form. Many have no symptoms, but some are fatigue, vomiting, etc. A vaccine can prevent from getting it, but can't help current people that have it. HIV is the virus that causes AIDS, transmissible through direct sexual contact or exchange of saliva, semen, vaginal fluid, blood, or other bodily fluids. AIDS is a disease of the immune system caused by human immunodeficiency virus, characterized by extremely low CD4 counts or susceptibility to opportunistic infections or illnesses. There are drugs that can slow the process, but there is no cure. Some ways you can reduce the risk of receiving an STI is choosing your partner safely. Make sure your partner isn't just some random person. Make sure it is someone that you know and trust. Another way is staying sober for sex. When you have alcohol and other drugs in your system, it can cause to make stupid decisions which can end up having an STI. Lastly, make sure you are prepared to use a condom to perform safe sex. When the time comes, make sure you have rehearsed and practiced on what you should do and why it is safe.